Hi, I am Elinor Silverstein, and today I am here with my dear friend Janet Varhus, and she is a brilliant and amazing holistic veterinarian. And she has opened my eyes to so many wonderful ways of helping me understand science because she's a science woman extraordinaire. And we've talked about cold lasers with each other, and she turned me on to the ozone machines, and I'm going to ask her a couple questions. So welcome, Janet, first. Welcome.
Thank
Thank
you.
you.
Thank you.
And Janet is has been practicing veterinary medicine and also has a degree in traditional Chinese medicine too, right?
Yes, in veterinary medicine.
Veterinary medicine, yes, yes, of course. And let's be clear. And we know each other through Tellington Tea Touch conferences and through Linda Tellington Jones, and that's where we meet marvelous people. But I just was listening to Dr. Mark Hyman last night on an interview, and it was for people studying functional medicine. So they're all MDs and maybe some nutritionists and other classically trained people who are learning to open their minds to other ways of using medicine. And somebody actually asked him about ozone treatment for COVID-19. And of course, my ears and my eyes popped up because you are the ozone queen. And he brought it up. He discussed it a little bit and thought he would talk about it more because they are finding out that they are having wild, oh, here's a kitty, having wild success using ozone to treat COVID-19. And in China, they're using it where they're using ozone and they're ozonating vitamin C and giving it to people coming into the hospital who are already suffering from it, and they're giving it to them IV. And the statistics of those that end up going home literally 2 days later after treatment versus those who end up in ICU on oxygen is
We're joined by my dog now. To see the kitty?
huge. You see the doggy? He goes, I don't care. I'm a grumpy old cat. So can you talk to us about the ozone machine? Because ooh la la.
Well, the ozone is pretty amazing because it disinfects. So you can boil water. You can bubble it through water and use that to clean your house, clean your vegetables, disinfect all the surfaces. But it releases oxygen into the air. But you can also, part of how they're treating it is ozonating blood and giving it back to you. Take your blood, bubble ozone through it, and give it back. And that inactivates the viruses or the bacteria or the cancer cells. And when you give it back, it's almost like awakening the immune system to see those things as foreign. But it also works with the Krebs cycle and increase certain enzymes to help metabolism. And it will also form ozonides in the body and peroxides, which help kill the virus. They've used it with SARS with great success, and that's just very similar. And it also has something to do with affecting the lipid layer, which has those prongs on the coronavirus that allows it to stick. And it impacts the cytokine storm that is what is causing all these people to need to be on a ventilator and the death and stuff. So there's just on so many levels the ozone can help.
So let's talk about the sticky part, right? So
Yeah.
because that's a really big deal, right? Because that is one of the pieces that's components that's causing so much terrible damage in people's lungs that they can't get through. Talk about what the ozone is doing with that. Give a little bit more because
Yeah, it has to do with the lipid layer, and it also stops that cytokine storm and the overacting immune system. And you can precondition your body by doing ozone even at least twice a week and help your body and your immune system be more prepared.
but it's
In
also
case
acting like the soap. Remember how they talked about
yeah,
the surfactant? right?
Yeah, yeah, to keep the virus from attaching.
Right. So, wow, so I talk about nitric oxide in the nasal passages and when we're inhaling through our nose, because that also stimulates that surfactant activity. Um, Surfactant or anti-surfactant? Surfactant, right?
Yeah.
Okay, so it's stimulating that, which allows it not to have that stickiness in the
Yes.
lungs when you're rich with nitric oxide. Um, but in through inhalation, specifically through the nasal passages, because it really ramps those levels up. So that's a natural thing. But the ozone, you know, it is a natural thing. It's in our environment, but here you're concentrating it, and oh, my cat's eating my sprouts that I'm growing for myself. That's my food. He's eating I'm trying to grow sprouts and
Oh no.
and he thinks it's kitty grass. And he's like, thank you, mommy. Take off the plastic. That's mine, everybody. So, but this is really worthy conversation because it's not a drug. It doesn't cost a lot of money. It's something so simply applied. And you've even talked about it in the veterinary field that you've helped cats and dogs with their teeth issues, because I had a dog who was supposedly with a cracked tooth and was an infection, and maybe she was going to have the tooth removed. And what did you say about that?
Yeah, it's very antibacterial. And like this little guy right here has been fighting an infection in his lymph nodes in his throat. And I've just been doing rectal ozone on him, and they're almost completely gone now. They never did rupture into an abscess.
And that's
Um,
kind of miraculous. And so let's talk about when it's given rectally and the the going directly into the vena cava. Is that
it
correct?
goes into the portal vein and then it goes right to the liver. I've had really good luck with, I just treated a dog recently with a liver infection, a high white count. I pulled off, it was about a 45-pound dog. I pulled off 6 cups of fluid out of its abdomen and injected ozone straight into the abdomen. And then they followed up with daily rectal ozone for 2 weeks, and the dog is fine. And they were referred to a specialist. Their regular vet said there was nothing they could do, and they didn't have the money for that, but they had the ozone, and it was very inexpensive, and the dog is doing fine. I did that with a dog with liver cancer, and it lived another 6 months doing great. After we pulled a quart of fluid off of its abdomen, it never developed ascites again, and had 6 good months. We did a horse with direct IV that was having liver issues, and the specialist kind of gave it up for dead. And we did IV direct, and she's gone about 15 months. And today we just tried with her. She's gone downhill again now after a year, and we tried pulling out blood and bubbling ozone through it and giving it back to her. So stay tuned.
Stay
We'll see
tuned.
how that goes.
Will you keep me in touch and let me know?
Sure, sure. And so it's a great thing to the even just rectally, and it's very inexpensive, but it's really strong.
Sorry.
I hope my other dog doesn't come because I don't have a big enough lap.
It's that time of the day. Okay,
Yeah.
Kitty's gonna hide his head in here, and Honey's gonna lick him. I love how these wonderful, easy therapies are being used for animals and now being embraced for people, and how we can help ourselves. And I would love if people are interested to talk with you more about it, because your knowledge in holistic veterinary medicine and how we can understand to help all of ourselves with, as we are all mammals, and what works for animals, what works for humans. I'd love to have more of these conversations. Would you be willing to?
That'd be great. There's a lot.
Learn.
There's so much you can do to boost yourself in this pandemic to keep, which we probably should be doing all the time.
Exactly. And you know, I had a very dear friend who also is a holistic veterinarian, and and he had a couple of surgeries back to back, and he was really struggling. And he ended up getting, an ozonator, and he lives up in Canada. And he did a couple of treatments for himself, but in one treatment got rid of the foggy headedness from all the anesthesia, because he had those two major surgeries back to
Yeah,
back. He was so foggy headed and feeling awful, and because he couldn't get it out of his system no matter what he did, and it got it out in like 1 and 2 treatments.
Dr. Frank Schellenberger recommends preconditioning, using ozone twice a week, because you never know when you'll have an accident or need a surgery or whatever. And the same totally goes for our pets.
Yeah. Wow.
It's a huge simple thing to do at home.
I am thankful for always being able to text you, message you, instant message, Facebook message,
Of course.
wherever we are, because you are so filled with answers and wide open thinking. And so let's have more of these conversations, because let's reach out and just share the knowledge with people. People can make their choices.
Sounds good. Sounds good.
There was a wonderful man in my life that once said, if you know what you're doing, you can do what you want. And that was Dr. Moshe Feldenkrais. And that just goes for everything. If you know about your choices and possibilities, you have more options to help yourself.
Well, that's good, as I'm changing my options.
You are. And you're on your horses and out there riding in Colorado.
I know, yeah. It's a nice part, living in the mountains and social isolation. My mule can take me far away from anyone.
Janet,
and we finally got warm weather.
We've been raining for 2 weeks. We're in Southern California. It thinks it's Seattle right now.
Well, we've had wind nonstop or snow, so this week has been great.
Janet, thank you. Thank you
bet.
Much. Let's make more videos to share and teach people what they can do to help themselves.
Sounds fun.
Thank you.
Thank you. Have a good evening.
You too.